Assalamu alaikum dosto, this is Dr. Kitty and I am back with another topic which is dens invaginatus. We were discussing differences in shape. Usually the difference between dens invaginatus and dens evaginatus is asked, but today we'll only cover dens invaginatus so that we can cover it properly. Now dens invaginatus, what can you think of? From the word invaginatus you can remember this, that there's an infolding of something, alright? Now I'll show you a picture first and then we'll discuss this, because you have to know what is an enamel organ. This is a picture. This is an enamel organ which is also known as dental organ, from which enamel is formed. It is a cellular aggregation over the dental papilla, and from this structure the enamel is formed. Alright? And from the dental papilla we see the formation of dentine. Let's see it clinically first so that you can have a better understanding what is dens invaginatus. Developmental dental anomaly characterized by a deep enamel-lined pit that extends for varying depths into the underlying dentine, as we just saw in the previous picture. As you can see, now what is happening? It is underlying in the dentine, the enamel, alright? Often displacing the pulp chamber and sometimes altering the shape of the root. As we can see in this picture, this radiograph, this is the enamel. This is the dentine and the pulp chamber, alright? And this enamel, it is displacing the dentine and the pulp. Let's continue. It is a developmental dental anomaly, as I've already told you, where the enamel organ enfolds or folds inward, creating a deep invagination or pocket lined with enamel, often in the maxillary lateral incisors, which creates complex anatomy. Thus, we can see a complex anatomy of such tooth, which can create further problems. Now, we'll move on to the types of the dens invaginatus. It has three major types, alright? The first type, it exhibits an invagination that is confined to the crown. We'll have to see the tooth structure before we discuss these types. Now, this is a normal tooth. This is the enamel, the first layer. Okay, this is the dentine. This is the pulp, this one. Cemento-enamel junction. Now, this is the cemento-enamel junction. Okay. Now, the type 1, it exhibits an invagination that is confined to the crown. This is the crown of the tooth. This whole area is the crown of the tooth. And these are the roots, as it is also mentioned. The first area, it is only confined to the crown. This is type 1. Okay. And now type 2, it extends below the cemento-enamel junction and it ends in a blind sac. Now this is the cemento-enamel junction, as I already told you. When dens invaginatus, it extends below this junction, cemento-enamel junction. It is known as type 2. Okay? And the type 3, it extends through the root and it perforates the apical area. Now these are the roots. And now when dens invaginatus will extend this area, alright, when it will perforate the apical area, it will be known as type 3. Now we'll read. Type 1. The invagination is confined within the crown of the tooth and does not extend beyond the level of the external cemento-enamel junction. As we already saw, I already told you that the first part, the first type of the dens invaginatus, it is only confined to the crown. Only confined to the crown. The second type, it extends beyond the cemento-enamel junction. It extends beyond this junction. This is the junction, alright? Cemento-enamel junction. This is the enamel and is joining the cementum. So junction between both of them is known as cemento-enamel junction. Now when dens invaginatus is extending beyond this junction, is known as type 2 dens invaginatus. Now what happens in type 3? It is extending beyond the apical foramen. Okay? It is perforating the apical area. It extends through the roots. These are the roots and it extends through it. Now we'll see what is the difference between type 3A and type 3B. The invagination extends through the root and communicates laterally with the periodontal ligament space. This is type 3A, when it communicates laterally with the periodontal ligament space. But in type 3B, it communicates with the periodontal ligament at the apical foramen. As I've already made you see that this is the apical foramen. In type 3B, it is communicating with the periodontal ligament at the apical foramen. But in type 3A, it is communicating laterally with the periodontal ligament space. Now we'll see the clinical features. Most commonly affected teeth. Now, the most commonly affected teeth are maxillary lateral incisors, but occasionally maxillary central incisors, premolars, canines, and molars can also be affected. Type 3 causes inflammation. As we were seeing, this was the type 3 where it was communicating laterally with the periodontal ligament space and communicating with the periodontal ligament at the apical foramen. So this causes inflammation. Invagination may resemble a tooth within a tooth. We've already discussed this, dents in dent. The invagination may be dilated and disturb the formation of the tooth. They say that the invagination, it can be dilated and it can disturb the formation of the tooth. Obviously, it is hindering the formation of the tooth, as in the proper formation of the tooth. Okay? Resulting in an anomalous tooth development known as dilated odontoma. Now we've already discovered what is an odontoma in the previous video. Odont means tooth and oma means tumor. Thus, in such cases, we can also see a dilated odontoma. And the last point, radicular dens invaginatus is rare. This condition is rare. Radicular means related to roots. So, dens invaginatus in roots, it is rare. Okay? Now let's see why it is a problem. It can be a bacterial trap, there can be a caries risk, we can see pulp necrosis, and due to complex anatomy, there can be other problems that we'll discuss now. Bacterial trap, the deep invagination collects bacteria and food debris. Wait, I'll show you this structure clinically. So now see this tooth structure and what comes to your mind. What problems can you encounter during the treatment of this structure? Obviously, first thing, bacterial trap, okay? A lot of bacteria can be trapped over here, which will lead to caries, okay? Which will lead to cavity. Moreover, there can be infection, which will lead to necrosis. And lastly, if you're performing a root canal, can you imagine how difficult it can be? Thus, the treatment of such cases can be quite difficult. Now we'll discuss the diagnosis and the treatment, how to do the diagnosis, and what can be the treatment of such cases. Diagnosis. It requires clinical examination. Of course, for anything to get diagnosed, it needs a clinical examination, sometimes with magnification, operating microscope, and specialized X-rays like CBCT. Obviously, you know that X-rays are a very important part in our dentistry. Now, come to the treatment. Early diagnosis is key for preventive measures. Treatment often involves root canal therapy, managing pulpitis or other endodontic procedures for complex cases. In order to treat it, we can go for restorations, root canal treatments, and in case of severe dens invaginatus, we can also go for extractions. Thank you so much. This was it for today. If you like my lecture, then kindly like, share, and subscribe.